Renal history.
Hypertension.
Extremities.
Okay. Liver. Increasing shortness of breath.
What goes against it?
Family history of the heart disease.
Hypertension. Exertion with going up hills.
Her being a smoker.
Her laying flat, so positive for orthopnea.
Liver being bigger.
Okay, and how about what's positive for COPD?
The green.
Smoking is pretty greenish sputum.
She coughs, greenish sputum. Breathing symptoms have worsened, but the cough is not getting worse.
Do we have a med list for this patient?
Is that?
Medication list?
Don't have that, sorry. Didn't collect that.
Greenish sputum, second one. History.
That's a fever of cancer.
So maybe the COPD too, maybe the hyperexpansion of the lungs because of the liver being below the costal margin.
Sure.
You want to say that?
Cardiomyopathy.
Yeah, Dr. Durward is also talking about possibility of malignancy.
I'm sorry?
Malignancy, cancer. Has she had any weight loss?
I don't think so. Probably had weight gain.
Yeah.
Great question for differentiating heart failure from malignancy. And again, you all are so skilled at generating your differentials and thinking about what data you want to collect to support them. And when our students are learning this, we can use really exactly that kind of help. It is so obvious to you about this process. You've done it over and over and over again. And for people starting out, it isn't that obvious. So how can we help our learners? Well, you can tell them to generate a differential early. And you're not asking them to generate that differential because you're trying to pimp them, but they don't do it intuitively. They don't do a comprehensive one. They'll think of one or two. They don't realize that this differential really should guide the data that they collect. Always good to tell them once they think that they recognize something, but just double check, does it really make sense? And that this gut feeling, which I think is really important for all of us as providers, sometimes that is right on. Sometimes that gut feeling just from a bad lunch, and it feels the same. So given this information that you've seen today, how are you going to change your approach to how you teach students, first-year residents, medical diagnosis?
Not telling them the answer,
Okay.
but making them figure out what the answer is. Have them work through it as to what they think the problem is.
So basically tell them the process and not the answer.
Sure.
Help them to go through and make a differential diagnosis, what it possibly could be.
Mm-hmm.
Can progress to it on their own.
And first make sure you're not compromising patient safety. If it's an emergency situation, the patient is coding. Yeah. Okay, go figure yourself.
We have to have them write down their ideas.
Our first responsibility is to our patients. On the other hand, we all benefited from people helping us learn how to do this.
I always think seeing it and looking at it, you remember a lot more than reading about it. So having them come in and see the person too.
Yeah, what's happened, like as a first year here with me, if the patient was not in an emergency situation, the faculty would say, so why don't you look it up in UpToDate and call me back? So I never forgot what I read in that 5 minutes because I was involved in the care of the patient and I ordered some tests and called the faculty back, and he or she would say, okay, so why did you do this, why did you do that? So I think that would be a good thing to do. Like, because we all read, but what the stuff that we read, if we already have a patient that we are going to use that information, we will never forget that. So I really like that approach, that many of us, our faculty, actually do that.
No, I'd read plenty about meningococccemia. I'd passed that test in medical school. And that didn't come back to me in the moment. It was seeing it, although it was a simulation, it was a real kid. Yeah, well, that got into my brain. So thoughts about how to help our learners that are totally lost. I've been impressed. There's really a big range of skills for a third-year student.
Now, the skills related to someone who does more intuition than the combined method, or is it?
Or just
Some people would naturally have more intuition, right? So.
But intuition without
Focusing.
knowledge, that can be dangerous, actually.
Yeah.
I mean,
So you got to focus on teaching them ways to analyze.
you should always question yourself, otherwise you can make bad decisions.
Especially you, Russell.
Oh yeah, definitely.
I'm going to lead you with one other thing. So we talked about having residents to try to use their analytical minds to double check their intuitions. So recently, this group of researchers did a similar experiment at the internal medicine residents. This time also included fourth-year medical students. Okay. Same thing. Hard cases, easy cases. Half the people were randomized to just say whatever comes to your mind first. The other one is, yeah, write that down, but double check. Yep. For residents, it didn't matter if it was a simple case. They were as accurate whether they did it off the hip, shoot from the hip, or plot along. Complex cases, yep, double checking, plodding along works well. Look what's happening with these medical students. The simple cases, oh my goodness, when we have them do that plotting thing to check their intuition with their analytical brains, they're actually much more likely to be right. So what's going on here?
Experience.
Okay, tell me more.
The medical students may have not seen the number of cases that would have led them to hone their intuition a little bit.
Yeah, so I think you're absolutely right. So I think for medical students, a case that's very simple for us is actually a challenging case.
Because you haven't seen it enough.
Yeah.
The simple case you see more, and you haven't seen anything.
You haven't seen anything. So yeah, so you've got all this book knowledge, and you're trying to apply it. So the reason I show this is that I sometimes feel like I'm really talking down to a medical student when it's something that seems very simple to me, and I forget that it's very complicated for them. Oh, by the way, with complex cases, they were miserable, and they can do it very analytically, didn't help them at all. It's too hard for them.
It's kind of reversed there, it looks like. So they overthink it.
Yeah.
So.
Like I said, they just don't have enough knowledge for these hard cases. So if anything, this tells me not only do I have to help them walk through difficult cases, I have to remember that a simple case for me is a really hard case for them. This is pneumococcal pneumonia. You know, they got fever, they got rusty sputum. Oh, wow, that's really interesting. But that's how, like you say, that's how we learn in medicine. Somebody that knows more than us are very kind and kind of walk us through. One last thing is that one thing that can really kill us in teaching is this hindsight bias. That once we know the answer, we think it's really obvious, and this never seems to be the case. Okay, so this is a pattern that petals around the rose. Does anybody know the secret? Yeah.
Petals around the rose. So look for the rose and the petals. The rose being the center of the die, and the petals around the center. You have to have the center in order to create the rose. So then, if the center is not present, then you can't call it a rose. So in the two that are above there, you have the 3 and the 5 that create the rose, and the 1 actually as well. But there's no petals around the rose on 1. There's 2 petals on the rose on 3, and there's 4 petals on the rose on 5.
So add the 6.
What the hell are you talking about?
So pretty simple, right? I sure didn't get it. Okay, so
Okay.
So you have the flower in the dice.
So there has to be petals around that.
So here we have 1, 2, 3, 4, 5, 6. And the take-home message for me is that recognizing patterns, once somebody helps us understand what the pattern is, it's really pretty simple to grasp. But most of us don't figure it out on our own.
And we have a genius among our residents, Dr. Gina.
No, he has the experience because he's seen this game before.
That's right.
He does a lot of online games.
So there's just 2 now? Is that what? Oh, there's always 6.
Well, thank you very much.
Always 6?
No, I don't know.
For your attention.
One in the middle.
Yeah, experience.
There is a evaluation sheet
There's
here.
only 2 in there.
So there are 6 petals there?
Oh, no. So for this roll, there's 6.
There's 6 petals.
Because-
Maybe you can see some more.
You roll the dice
So
again.
it's 2 of them petals. Yes. Okay. So
There are no
this
petals on
time
that one.
there's no, yeah.
Although there's 3 roses.
There's
2 roses.
Okay, I didn't hear her about this.
4. Yeah, okay, I got it. You didn't
Were they prime numbers? Is that what the deal is?
Can you use that again?
Be like, oh, what's that movie where she's like,
He was getting ready to use it now, huh?
Yeah, I was. Make me late for the next delivery. I got to do it. Baby's going to hit the ground and talk over the phone. That was your pin?